Hello, Dr. G here. I want to give you a heads up about a new government medical coding system that's coming your way later this year. It's the ICD10, and it's going to replace the ICD9 that the healthcare system uses now. Now, the reason you need a heads up is that your doctor is going to be extremely distracted when this is implemented, and he or she probably won't be giving very good health care during that time. Now, on the plus side, the bad care probably won't be permanent. At least I hope not. I figure doctors should be able to get the hang of the new system within 2 to 3 years. So you might ask, Dr. G, why the pessimism or optimism? Okay, imagine this. One night you go to bed with a vocabulary of 17,000 words. The next morning you wake up and suddenly you have to deal with a vocabulary of 155,000 words. You see, the ICD-9, which are the diagnostic codes for all the illnesses and conditions that you might have, has 17,000 different diagnoses. It's going to be replaced this fall by the ICD-10 that will have 155,000 diagnostic codes. Yes, your doctor will be confused, but the government says the new system will be better for keeping track of what doctors do, what conditions are occurring in our population, and what your doctor is being paid is appropriate for what they're doing and seeing. Now, okay, I know some of you pessimists out there are probably thinking that the government, by adding more bureaucratic stumbling blocks, will probably mess up the healthcare system even more than it already is. But I say, hey, give them a chance. Let me give you a scenario where the ICD-10 is better. Now let's say you got struck by a bird. The government or public health might want to know what kind of bird it was. If they had this information, they could go out and exterminate all those nasty birds that are injuring people. You see, the ICD-9 doesn't even have a code for being struck by a bird. But the ICD-10 will have separate codes for being struck by a parrot, a macaw, other citizens, chickens, geese, and even ducks. Now, I know some of you are probably saying, what if I was struck by a condor? No problem at all. Use code W61.92. That's the code for being struck by other birds. So if you're struck by a condor, just make sure your doctor looks through the codes, and when he finds that condors are not listed, he can use that code W61.92, which means it was another bird besides parrots, macaws, other citizens, chickens, geese, or ducks. Because for those, there's another code. This isn't rocket science. It's simple. And speaking of rockets, in addition, the ICD-10 will be very helpful for doctors treating those prone to spacecraft injuries, because there's 48 different codes related to these injuries, including V95.45XD, which is the code for spacecraft explosion injury, occupant, subsequent encounter. Now, for those of you that visit SeaWorld on a regular basis, there's 19 different codes for your injuries that are inflicted by orcas. Now, that should make you feel a lot better. Now, yes, in my view, these changes are ridiculous and likely to make an overloaded system even more cumbersome, as well as cost doctors and hospitals a bundle to implement. I'm sure the switchover will drive a lot of us older physicians into retirement. But then again, maybe that's the ultimate plan. And yes, I know that I and many other physicians are going to suffer with the ICD-10. But you, the patient, will suffer even more. But you can take yourself out of this doom spiral. Check out our alternative health program on the website naturalfoodsdiet.org. This is Dr. G. Thanks so much for watching.